Before I model and explain application and fit, a reminder that we do want to complete perineal care each and every time a product is changed. It's also important that when we open a product, we do so with care. We don't want to snap or flick the brief, as that will dislodge the placement of materials which are in vital positions for absorbency. The other point I'd like to raise is that we do like to fold the brief lengthwise, because that releases the inner leg cuffs, which curve nicely around the body, around the inner thigh, and that helps to capture and contain fluid and feces. So as you can see, I am now wearing a brief, and it looks okay. I should mention though that there should be about a finger's width of space between the product and the inner thigh. And on me here, there's actually about a 3 or 4 inch gap between my perineum and the product. And this is ample space for urine to find its way out. The brief must fit up close and personal. The closer the product is to the perineum, the better the absorption and containment. A bigger brief is not better. It will leak, it will gape. Yes, there's more fabric for easier application, but the result is a looser, sloppier fit, as you can see here at the back, and that too will encourage leakage. With the correct size, fitted well, the chance of leakage is minimal to non-existent. And now I am wearing the proper size brief. Earlier, I stated that a bigger brief is not a better brief because it will leak and gape, and the sloppier fit encourages leakage. With the correct size fitted well, the chance of leakage is minimal to non-existent. Now on each product you will find the wetness indicator, and this is helpful to show when the product has been activated. Staff generally change products when the indicator line is a certain percentage full. It is vital to change and complete personal care as soon as possible after a bowel movement. And with the void of urine, the brief draws the fluid away, enabling the individual to wear the product, often for a few voids, or maybe even up to several hours. I've now removed my brief and have it here on the table to demonstrate the new secure grip fasteners that may be newer for some who are used to the older traditional style 4-tab fasteners. These new tabs are now longer and they adhere well to the product, allowing for good conformity to the body. I do like to angle these tabs accordingly based on the person, the wearer's body shape. I may angle the tabs in like so, depending on the body shape. For somebody else, I may angle it the very opposite way, depending how the fit will work for the individual. At times, I may further be more precise in my application by angling the tab partway down, and that allows it to really fit and curve closer to the hip or the waist. Another point I would like to raise to you all is what surrounds Mother's Day or perhaps birthdays, and that is gifting our loved ones with creams or lotions. I have seen some folks, staff generally, do excellent personal care, and then when they apply creams and lotions, it's on very thick, and that can rub off onto the core, inhibiting the absorption of fluid into the core of the product. What I suggest is caregivers put a sparing amount on their loved one or on the person they're caring for. And for caregivers wearing gloves, I suggest that rather than wipe their hands on the core, wipe their hands up in the corner away from any of the power part of the brief where we need that product to do its work and absorb well. Now let's review a few hints and tips. And to review and summarize, there are 2 main causes of leakage. It is so important that we wear a product that fits. The importance of the tabs fastening on the hips, not on the center panel, can't be overstated. And wearing a product best suited to the type of incontinence, whether it's stress, urge, overflow, functional, or total, is so important. A light pad may no longer contain the gush of fluid experienced with urge incontinence. Or protective underwear is hardly the product of choice for total incontinence. Now, I should mention too that double padding is the primary cause of urinary tract infections, UTIs, and skin challenges with respect to incontinence. Double padding means that you have somebody wearing a product, perhaps it's a brief, and then Another product is placed within, ideally to increase absorbency. However, this is so well illustrated when it comes to urinary tract infections when I spoke recently to a family member. The lady I spoke to was a retired registered nurse and her mom was 99. The mom had her first UTI, and that was a few weeks prior to our call. The mother, until recent days, had worn protective underwear very successfully, but as she started to decline, she needed more than protective underwear. However, instead of putting on perhaps a shape pad or even a brief, the caregivers started adding in another pad inside her protective underwear. All that extra warmth, moisture, lack of air movement was far too much for her body. It was very unfortunate that a urinary tract infection was the result. And I should add that if there is double padding happening, the easiest way to remove that inner pad is simply to pull it out. And we are left with shearing, chafing, skin that is so susceptible then to breakout and breakdown and infection.